Hello, everyone, and welcome to Living Healthy and Aging Well. My name is Ken Haglund, and we are broadcasting from the AM 950 radio station that overlooks beautiful Bryant Lake Regional Park, located in Eden Prairie, Minnesota. I am so grateful to be here with you today, and I hope all of you listening are doing well. We are on the air every Saturday from noon to 1 to talk about your health and your life. We cover a wide range of topics to help you and your loved ones improve and enjoy your quality of life. I want to thank all of you that leave messages on our radio show phone line. We appreciate hearing from you, and we welcome your comments, questions, and topics for future shows. Also, if you are interested in being a guest on our radio show, please call or text us anytime at 612-999-3426. We look forward to hearing from you. Now, we are adding new listeners to the show each week, not only here in the Twin Cities of Minnesota, but also throughout the country. You can find podcasts for all of our shows on the AM 950 radio website, and we can also be found on Apple iTunes, Spotify, SoundCloud, Podbean now is one, and many other podcast and streaming services. So you can find us pretty much anywhere. Also, I want to mention to you that we have a great show for you today. Are you currently on Medicare or know someone who is and are wondering what you need to do to be ready for the upcoming Medicare open enrollment period that we are currently in? Well, you are tuning in to the right show today, because joining me in a few minutes is Mayla Yang. She is a community outreach specialist with Trellis, and she's here to discuss Medicare's open enrollment period and the valuable resources available to all Minnesotans as we all try to decipher the complexities of Medicare. Open enrollment for current Medicare enrollees runs from October 15th through December 7th, so now is the time to make any changes to your plan. Mayla will discuss the senior linkage line services that they provide and share information on how to register for free, unbiased Medicare counseling. Also, free presentations on a variety of topics related to aging. And of course, the upcoming Medicare open enrollment period that we are in right now. Trellis has been an innovator and thought leader in the field of aging for over 25 years and works to help people optimize well-being as they age. You will enjoy hearing my conversation today with Mayla Yang. Before we talk with Mayla, I want to mention our new website has been launched, and you can find us at livinghealthyagingwell.com. There you can find information about upcoming guests as well as listen to my podcast interviews with previous guests. That's livinghealthyagingwell.com. And I want to thank Julie Hamilton and her team at Avalo Web Development for their amazing work on our website. Thank you, Julie. Okay, I want to welcome my guest today, Mayla Yang, a community outreach specialist with Trellis. Welcome to the show, Mayla.
Thank you so much, Ken, for having me. It's a pleasure to be here.
Oh, and this is great. And this is such an important time of the year. Right now we're in the middle of the open enrollment period, which happens once a year. Very, very important. And I know it can be very confusing for people, so it's great to have you here at this time of the year. Before we begin our conversation, I do want to thank Jetta Wiedmeyer-Bauer, the volunteer and outreach manager with Trellis, for her outstanding help with today's show and her coordination with my executive producer, Jennifer Ogren. Thank you both. This couldn't have happened without you. We sure appreciate that. Mayla, tell us about your background and maybe what inspired you to join Trellis and help our seniors and their families.
Yeah, thank you, Ken. Definitely. So I have the honor of creating trusting relationships with our community organizations and their members to bring awareness of the senior linkage line and the services that we provide. I have worked with older adults for over 5 years in a different varieties of capacity, working with them in the older adult settings, providing the right care support, as well as educating and resource referrals and sharing. And prior to my work at Trellis here, I worked as an engagement caregiver coordinator, working closely with caregivers and older adults that had dementia. And so I just find it being very valuable to educate on the resources that are available in the community.
Yeah. Well, thank you for that, because we do need the best and brightest helping out in our elder care, senior care area. It is it's an area that is growing, and there's so many needs. And it's getting more complex, it seems like.
I agree.
And so people like you joining to help everyone support that is just fantastic. So I know Trellis is happy to have you there. And I know all the people that are associated with you and hear you, because I know you get out to the communities and talk to people at senior centers and other places, right?
Definitely. So yes, my role as a community outreach specialist at Trellis, we provide presentations to the community members, to professionals working with older adults in the community setting, like you said. So it could be at adult day centers, at community centers, virtually, on our Zoom platform. So anyone living anywhere can join and tune in on our presentations that we offer.
Right. And it's for all Minnesotans. And you don't have to be a senior to take advantage of these great resources, right?
Definitely. That is correct, Ken. And, we like to share the resources with caregivers as well, that they're very important. They play an important role with the older adults. And so, like you said, anyone, whether you are an older adult, a caregiver, you can join in, tune in, and education is just so important. And so that's what we offer.
Well, and what's important, too, people need to realize is it's important to hear things more than once. When we hear something for the first time, it's hard to remember everything. And it's nice that you guys have these programs that outreach into the communities. And what's great is you're helping not only the seniors themselves, but also the caregivers, because it really is a partnership in taking care of our seniors and our elder population.
Definitely. And not just presentations that we offer, but as a community outreach specialist, we table at different events. And so, for example, there's an event tomorrow at the Rogers Senior Fair that we will be tabling at to provide the resources and information that are free and available to all Minnesotans. And
what I found, too, is there's a lot of conventions and get-togethers that are now happening as we kind of go post-pandemic here. And it's been great to see that people are getting out. I mean, we were just at a recent conference, and it was attended by hundreds of seniors.
Yes.
And it was great to see that they're reaching out because they're looking for information. They're looking for help. And it's great to go to a source like yours, which is unbiased. I mean, again, you guys are there to help people navigate through life as a senior.
Yes. That's exactly what we do. We, at Trellis, our mission is to help individuals to age well and to develop the capacity of communities to care for the aging population. And so, like you said, our resources and services are free, neutral, and objective. And so we do not recommend one service provider over another. We give out all the options that are available to the consumer, and then from there, they decide what is best for them and their situation.
Yeah, and I want to also mention, you guys have recently changed your name, and I want to get that here in the first segment if we can, so people understand kind of who we're talking about.
Definitely.
That you originally have been known as the Metropolitan Area Agency on Aging.
That is a mouthful. Yes,
right,
that is correct.
MAAA.
Yes.
We've known about that for years and years and years. And then just this year, you made a change. Can you talk about that a little bit?
Yes, I definitely can. And so, yes, this year in March, we made a change to the name. Our services and our resources still stay the same, and we are still providing the same resources. But with the name change, we changed the name to Trellis. And so, as we all know, Trellis is a structure that provides support. And with that, we have evolved, and we see ourselves as an organization that supports older adults, caregivers, professionals, and their families. And we changed the name because the Metropolitan that serves the Twin Cities, and our services have evolved to 6 other states outside of the Minnesota. And so that's kind of where the name change is. We are growing as an organization, and then the new name represents the growth and the change that we are providing right now.
Right. And are you still associated with the Minnesota Board on Aging as a part of your association?
Yes, definitely. We are funded. The Senior Linkage Line is funded through the Minnesota Board on Aging.
Okay. And that's another reason why these services are free to Minnesotans. Mm-hmm. And it's again, what's nice is it's not just for the seniors, it's for their adult children. It's for anybody. Right. It's for professionals, caregivers, family members. Anybody can call.
That's correct.
And get help with the questions they may be having.
That's correct. Anyone can call. There is no age limit. Anyone can call. You do not have to be a senior to call the Senior Linkage Line.
Right. I know that was a question that came up previously when we had
Right.
had some of your colleagues on.
Yes.
And they said, no, it's because I had a call for someone who said, do I have to be over 65? And I said, no,
You do not.
you can call.
Yes.
Anybody can call. Anybody who's helping other people can call. Okay. All right. Well, so Trellis has a new name this year. Now, does it have a new website address then as well?
Yes, and I am glad to share that. So our website is trellisconnects.org, and on there are a variety of resources and services that we provide. You can check out our website, trellisconnects.org, and get all the resources that we are sharing today on our website.
Okay. Now, if somebody doesn't have a computer or access to that, is there a phone number that you would give out that they could call?
Yes, so our senior linkage line number is 800-333-2433, 800-333-2433. And we are available Monday through Friday, 8 to 4:30.
Right, 8 to 4:30, Monday through Friday. Fantastic. All right, it's time for a short break, folks. We'll be right back to continue our conversation with Mayla Yang, a community outreach specialist with Trellis. And we'll be right back after a short break. You're listening to Living Healthy and Aging Well. I'm Ken Hageland. Please stay with us.
Now, more than ever, we are being faced daily with the topic of human mortality, and for many people, estate planning has been top of mind. Getting your estate planning done now can be easy and cost-effective. Schroman Law offers virtual options for initial consultations so that new clients can safely initiate the process. With many facing uncertain financial situations, Schroman Law also offers affordable fees for legal documents. Learn more at schromanlaw.com. That's SCHROMEN law.com.
Fine dining, walking paths, gardens, and green space, the sound of children playing, groups gathered to sing and paint, prayer groups and water aerobics classes. Those are the sights and sounds that greet you at Episcopal Homes Assisted Living. Located close to Highway 280 and University Avenue, this charming community offers studio, 1- and 2-bedroom apartments. Services to help you get through your day are provided by a compassionate care team who get to know you, what you like, and your routines, just like a second family. Stay as busy as you like attending art or exercise classes, take in live performances or a movie at the theater, gather with friends at the bistro or pub, head outside and read to the children from the on-site childcare. Episcopal Homes Assisted Living also offers memory care with specialized activities and support for those impacted by memory loss. Part of a continuum of care, Episcopal Homes has proudly been serving older adults for over 125 years. Check out episcopalhomes.org for more information.
SeniorCommunities.guide is your free online website to find housing, care, and resources for seniors in Minnesota. Use the powerful, award-winning search tool to quickly improve your search. You will have all the information you need to contact providers directly without any hassle. Start your search now at SeniorCommunities.guide and follow us on Facebook for interesting articles, helpful advice, and how older adults are changing the world.
SeniorCommunities.guide. Don't be surprised if you hear your name when you walk into St. Paul Corner Drug. Our experienced staff make getting to know you their top priority. Developing a trusting relationship with our patients is the first step in providing personalized care that achieves the best outcomes possible. Make certain all your providers know who you are and what your needs are. It is a vital step in your well-being. Stop by St. Paul Corner Drug today to start a relationship with a staff that cares. St. Paul Corner Drug, pharmacy the way it should be.
Shop Minnesota's biggest in-stock selection of appliances at Warner Stellian. Show off your unique style and save 10% on an innovative LG suite before our extra 5% rebate. Trust our specialists in your home with free delivery in Holloway done right. Buy smart and open a Warner's card to earn up to a $100 bonus. Then pay no interest for 18 months. Save an extra 5% on thousands of in-stock appliances. Shop our 10 Minnesota stores or buy now at warnerstellian.com.
Welcome back, folks. You are listening to Living Healthy and Aging Well, where we talk about ways to improve your health and your quality of life. My name is Ken Haglund, and joining me today is Mayla Yang, a community outreach specialist with Trellis. And we are talking about Medicare's annual open enrollment period and the valuable resources available to all Minnesotans as we all try and decipher the complexities of Medicare. And we're also talking about the senior linkage line services that they provide and how to register for free, unbiased Medicare counseling, as well as free presentations on a variety of topics. And we'll talk about that here this segment, all related to aging and, of course, making sure we let people know how important that the current open annual Medicare enrollment period is. And before we return to our conversation with Mayla, though, I want to mention, if you or a loved one are interested in fine dining, walking paths, gardens, and green space, the sound of children playing, groups gathered to sing and paint, even prayer groups and water aerobics classes, those are the sights and sounds that greet you at Episcopal Homes Assisted Living. Located close to Highway 280 and University Avenue, this charming community offers studio, 1- and 2-bedroom apartments. Services to get you through your day are provided by a compassionate care team who gets to know you and what you like and your routines and become just like a second family. Stay as busy as you like attending art or exercise classes, take in live performances or a movie at the theater, gather with friends at the bistro or pub, head outside and read to the children from an on-site daycare. Episcopal Homes Assisted Living also offers memory care with specialized activities and support for those impacted by memory loss. Be part of a continuum of care with Episcopal Homes, and they have been proudly serving older adults for over 125 years. For more information, visit episcopalhomes.org, episcopalhomes.org. All right, Mayla, let's remind our audience how they can find more information out, either by website or by phone.
Yes, so if you have a device, you can go on our website at trellisconnects.org. Or if you want to call the helpline, the number is 800-333-2433. We are available Monday through Friday, 8 to 4:30 p.m.
All right, and that's open to anybody. You don't have to be a senior to take advantage of that great resource. All right, fantastic. Well, let's talk a bit more about Trellis. Again, it's a new name for a long-standing organization that's been helping Minnesotans for 25 years. But let's talk more about Trellis and how it relates to the senior linkage line and how all that goes together.
Yeah, definitely. So Trellis is a designated area agency on aging for the 7-county metro area of the Twin Cities. And so we are one of the 6 area agency on aging throughout Minnesota. We are a nonprofit organization that provides services, information, and connections to assist older adults, persons with disabilities, and the caregivers who are caring for their loved one. And so we are innovators and thought leaders in the field of aging. Along with our everyday work, we focus on creating new products, services, and relationships to meet the changing needs of our growing population of older adults. And so this is accomplished through a variety of ways, and we have many different partners that we work with closely within Trellis. And so a few of them that I'm going to highlight is, one, our Juniper program that delivers classes, to evidence-based classes to older adults to help manage chronic conditions and prevent falls, as well as Tai Chi, just, matter of balance, movement. We want to empower and promote older adults to live a independent life, a healthy life. And so Juniper is one of the programs that partners with healthcare systems across Minnesota to offer these classes that are free or low cost to Minnesotans. As well as that, we award about $8 million a year in older American adult funding to support low-income older adults. And the organizations may serve older adults with transportation, meal delivery, chore services, caregiver support. These are, we call it our Title III funding partners. And so anyone that support the low-income older adults is another service that we provide. And then our pension rights and retirement network that I briefly mentioned serve the 6 states, Minnesota, Wisconsin, South Dakota, North Dakota, Iowa, and Nebraska. dealing with pension rights and retirements. And then we are also dementia-friendly community initiatives that we help with. There are 3 that we partner with at Trellis, Act on Alzheimer's Program, Dementia Friends of Minnesota, and the Remember Project. And one that I wanted to highlight is the Dementia Friends Minnesota, which is a global movement that helps us to change the way we think and talk about dementia. And so that helps to promote a dementia-friendly community for all of us.
And what's interesting, of course, is as I talk to people, and of course the practice that we have in hospice, dementia is the epidemic of the elderly. It's just one of the worst diseases, and it's great to see you guys focusing on that, right. Because as we see this continual change in the needs for that particular population, it's so important that people realize that there are resources out there. And we talk to families all the time, yes. And they don't know where to turn. That's why it's so important we get you on the show here. And you just rattle off so many services there, and we're gonna talk about that again here later in the show, yes. Just to remind people. But some of these are really important, as you mentioned too. The senior population is growing.
It is,
and it's growing at a rate that's going to eclipse for the first time in history the age population from 18 and under. It'll actually be larger than that, and that's the first time ever in history that our population 65 and older will be larger than the 18 and under. So the needs are great, and as the Minnesota Demography Office has shown it, we have 600,000 people that are trying to help support people in an unpaid fashion, and they don't have access to these right. resources, and I guess, but they do through you. I mean, they can get this information through you, which is so important.
Yes, most definitely, Ken. And that's why we are here at the Senior Linkage Line to raise awareness of the help and the services that we offer. And it is free. And that's very important to share with our community members because it's a free service that is available to all Minnesotans. And so we want to raise awareness on that.
And what a great organization. I know you've got just many, many people. You guys are growing itself. You're adding more people, and again, this Senior Linkage Line is such a great connection to our communities, and it's a way to get access to information, folks. If you have any question, don't think it's limited to Medicare. This is about really any right. type of question you have related to aging.
Yes.
Exactly. So you got to give them a call. All right, folks, it's time for a short break. We'll be right back to continue our conversation with Mayla Yang. She is a community outreach specialist with Trellis, and we are talking about Medicare's open enrollment period and the valuable resources available to all Minnesotans as we all try to decipher the complexities of Medicare and deal with the aging. So please stay with us. You are listening to Living Healthy and Aging Well. I'm Ken Hageland. We'll be right back.
Senior Linkage Line is a free statewide service of the Minnesota Board on Aging, helping older Minnesotans and caregivers find answers and connect to services and supports. Questions about Medicare, transportation, looking to move to senior housing, overwhelmed with prescription drug plans? Call the Senior Linkage Line at 800-333-2433 or visit trellisconnects.org, where we help people optimize well-being as they age. That's trellisconnects.org.
Overwhelmed trying to make sense of Medicare? As a licensed advisor, I can help you determine your healthcare needs and evaluate your options. I'm Harvey Pearl of Pearl & Company, and I want you to have the peace of mind knowing you have the best coverage available. You deserve an advocate you can trust and coverage you can rely on. And there's no fee, ever. Annual enrollment is October 15th through December 7th. Call me now at 651-303-8889 so we can strategize together.
Nightingale is your cozy, comfortable neighborhood restaurant in the Whittier neighborhood at 26th and Lindale. Nightingale has patio, dining room, and bar seating available. Plus, they still have takeout and delivery. Their menu has lots of delicious options like the famous Nightingale burger and fries, ginger tamari chicken wings, smoked chicken liver pate, and more. They're open from 5 p.m. to 1 a.m. daily with their full menu until midnight. So make the friendly neighborhood Nightingale your go-to restaurant in South Minneapolis. Place an order, make a reservation, and more at nightingalempls.com.
Taking prescription medication should not be a scary task. The staff at St. Paul Corner Drug makes certain you know everything about your prescription medication before you leave the pharmacy. Knowing what to expect and when and how to take your prescriptions gives you the confidence to safely take your medication and maintain good health. Should additional questions arise, we are here to help sort things out. St. Paul Corner Drug, pharmacy the way it should be, at stpaulcornerdrug.com.
I'm John Peterson of Ferndale Market, and I'm the third generation to grow turkeys on our family farm in Cannon Falls. We've grown them the same way since 1939, free range and without antibiotics. We're proud of the way our turkey tastes naturally, so we never add fillers or basting solutions, just 100% pure turkey. And we're proud to remain an independent family farm. Looking for an extra special addition to this year's Thanksgiving feast? Our fresh, never frozen turkeys remove the hassle of thawing and can be picked up just days before your celebration. Available at natural food stores across the region. Reserve your fresh, free-range Thanksgiving turkey for pickup at our store right on our farm in scenic Cannon Falls or at one of our retail partners. For more information on finding our Ferndale Market Thanksgiving turkey near you, visit us at ferndalemarket.com. That's ferndalemarket.com. Thank you for your support of local foods and farmers. We'll hope to see you at Ferndale Market soon. ferndalemarket.com.
Welcome back, folks. You are listening to Living Healthy and Aging Well, where we talk about ways to improve your health and quality of life. My name is Ken Haglund, and joining me today is Mayla Yang, Community Outreach Specialist with Trellis. And we are talking about the Senior Linkage Line and Medicare's open enrollment period, which I hope you guys are paying attention to. It's very important for either you as a senior and enrollee or the adult children to make sure that you're taking advantage of this open enrollment period, which happens once a year. And we've been talking about that. So before we get into our conversation again with Mayla, I want to mention that Episcopal Homes, located in St. Paul, Minnesota, is proud to provide a full range of senior living and home health services. And there are many, and Episcopal Homes is one of the top-rated senior communities by U.S. World and News Report. And some of the services they have are transitional care and short-term rehabilitation. They've got their church home. They've got assisted living at Iris Park Commons, memory care assisted living at Katie's College and Iris Park Commons. They actually have home care services. They also have a program called Neighbor Care, which helps support people in the neighborhood around the campus at Episcopal Homes in St. Paul. They also have independent living, affordable senior housing, intergenerational child care as well. So if you have any questions or are interested in any of the services for the Episcopal Homes located in the urban core of St. Paul, call or look online and visit them at episcopalhomes.org, episcopalhomes.org. All right, Mayla, let's remind our audience, too, how they can get more information if they have questions about Medicare, transportation, all the things we talked about. What are the two best ways for them to get more information?
Yes, so you can visit our website. It's trellisconnects.org or call our helpline at 800-333-2433. We are available Monday through Friday, 8 to 4:30 p.m.
All right. And beautiful new website, folks. Really should check that out, trellisconnects.org. All right. Well, let's continue to remind people about the amazing services you guys offer through the Senior Linkage Line.
Yes. So we are a partnership with the Minnesota Board on Aging, as I had mentioned earlier. We provide Senior Linkage Line services that are free information, resource and assistance on topics such as Medicare, long-term care planning, food and housing referrals, finding transportation in the area that the consumer lives in. We like to research on what is available in their area and what is best for their situation. And so when someone calls the line, we will listen to their situation, and then from there kind of explore the different options that are available, and then the consumer will decide what is best for them and their situation. Aside from that, we offer our educational presentations that are available to not just Minnesotans, but anyone, because we can do them virtually online as well. And so we have 5 presentations that we offer. Medicare 101, that just gives the basics of Medicare, talks about the different parts to Medicare, Part A, Part B, Part C, and D, and what that means. And then annual Medicare update, which is right now, currently with the open enrollment period, October 15th to December 7th, we are giving out our annual Medicare updates presentations to community members, professionals, just anyone who would like to know the changes and updates that our Medicare is involved with. And then we have our healthcare fraud and our healthcare directives presentation, as well as the senior linkage line, who we are and what services and help we offer. So those are some of the presentations that are available to community members, professional, and just about anyone that is interested.
So are those on demand then, or do they register for it being presented live? What do people, should they expect them when they sign up for those?
Right, that's a great question, Ken. And so on our website at trellisconnects.org, under the Get Help tab, you can see that there's upcoming presentations. And so if you click on that on the website, you will be able to look at the presentations that are coming up. You can sign up for a virtual presentation. So we have every once or twice a week, we have, for example, the annual Medicare update, or we have Medicare 101. Today, for example, we had an annual Medicare update presentation at the Shoreview Community Center. And then tomorrow, we have the annual Medicare update for the American Lung Association. So organizations can request for a presentation on our website, or for consumers or those individuals who would like to sign up for one that is offered through Trellis, they can sign up on our website. Okay, so it's really easy, folks. Go to the trellisconnects.org, go to the Get Help. That's the first drop-down on the top of the page, and there you'll see the upcoming presentation section, and there's just wonderful presentations here. Yes. And so are those held? Those are scheduled. And are they live presentations, or are they recorded presentations? So they are scheduled and they are live presentations. Okay. Yes. So are people able to ask questions or type in a question, do you know, with that program? Yes. And so they are, since it's through Zoom, and there are, you can ask a question, or you can drop it in the chat box, and it's live. So we present, and then if a consumer has a question, they can ask the question right away, or wait until the end to have kind of like a Q&A session. Sure. Okay, great. And what great topics. I mean, these are topics that come up in conversations with seniors and their adult children all the time. Right. So fantastic. About how long would any of these presentations be, just so people have a sense for how long they are? Right. So the longest presentation is 1 hour and 30 minutes, but roughly an hour long presentation. Okay. Yes. All right. Well, that's fantastic. Mm-hmm. What I want to mention to people and make sure they understand this is you guys are doing the research for all of us in Minnesota. I mean, you people can struggle trying to figure out all kinds of things, right. But really the best place to start is with you guys. You've already done the research. You've already found out all the different services and resources available. It's best to call you and then get a head start on that process. Yes, and so that's really great to point out, Ken, that we have all the resources and information already. And so if for those who are comfortable calling in, we have the database that we use, minnesotahelp.info, which provides 42,000 providers on the website that we can, like I said earlier, kind of look at the consumer's zip code and where they live and see the different providers and services in their area. And then from there, let them know of the options. And then the consumer can kind of say, maybe I want to go with this one instead of this one. And then, from there, we will connect them to that. So we do not provide the direct care service at our location, but it's more of a referral and resource sharing for the consumer.
Yeah. And just so people know, they can be calling from Duluth or Rochester or Mankato, St. Cloud, anywhere in the state of Minnesota. And when they call in, it kind of recognizes the zip code or the phone, the exchange number they're calling from, so that the services that are being suggested for them are in their area.
That's correct. So you can be living in Duluth, and we can assist you. Mankato, we can still assist you. And the Senior Linkage Line service is a statewide service, and so all the resource and services that are provided are the same throughout.
Yeah. Yeah. Well, great information here on the website, folks. I'd really encourage you, check the website out, trellisconnects.org. Now, great website. So I'm just curious, how has COVID-19 changed the way you guys provide services?
Right. And that's a great question. And so, we had to quickly adapt to the changes that were happening with COVID-19. The services that we provide still stay the same, but accessibility was key for us. And so we had to think fast, how can we reach the community members? And with that, we started doing our virtual presentations. As I had said, we offer them virtually through Zoom or our in-person services were on pause, but a lot of our presentations were through Zoom. And then we were also able to mail out resources to community members or organizations that may need the service or resource.
Right. Oh, which is great. All right. We've only got a few minutes left in this segment here. I want to start the conversation. Can people schedule one-on-one appointments with a counselor from the Senior Linkage Line, or is it just you can only just call in?
Right. So you can do both, but they can schedule for a one-on-one appointment if they want more time and if they prefer something that would work best for them and their schedule. Instead of waiting on the line, you can go on our website at trellisconnects.org, and under that same tab, the Get Help tab, you can choose the Help with Medicare.
Okay, that's the bottom option.
Help with Medicare.
Oh, number two. I see it. Yep.
Yes, and then from there we have two options. You could either choose to schedule an appointment over the phone, or you can choose an in-person appointment, and they're both one-on-one, and the specialist will be able to kind of listen to your problem, your concerns, or the plan that you have, and then from there kind of educate you and raise awareness on the options and the plans that are available with Medicare and the changes.
Mm-hmm. This is really important. I think people need to understand this. It's not just phone. That's how that first connection can be made.
Right.
But you can literally set aside an hour to just talk with someone. Because, again, Medicare is not simple. It's kind of complex.
It is.
And our lives are complex. And so you don't want to feel rushed when you're talking to somebody on the phone. But you can literally set aside, make an appointment for a 1 hour appointment.
Right.
And really talk things through. And that's fantastic. And then also you guys are open to bringing that information out in person as well. So groups and different sites in the community can get access to having, and you're one of those people, right? That goes out
Right, yeah. So with the in-person appointments, that is staffed by our amazing volunteers that we have.
Yeah, that's right.
And so there are 27 sites throughout. They can be in the community center and Haste, for example, a senior center, and anywhere in the community setting. And so our volunteers staff those different sites. And they will be able to listen to your concern. For example, someone coming in, their prescription drugs may have changed. And so they can help them kind of look at the new changes with their prescription drugs and then kind of let them know which plan would be maybe fit best with their options. So, for example, giving them 3 different options, and then the consumer can choose, I prefer option A over option B. And then the specialist will be able to kind of help them to make those changes for the consumer.
Right. And I think we talked before how many plans there are. There's just over 100 different options, and maybe more than that. There's just a lot. So I really encourage people, give you guys a call at the Senior Linkage Line. And what is that number for the Senior Linkage Line?
Yes, it's 800-333-2888. 800-333-2433.
Fantastic. It's time for a short break, folks. We'll be right back to continue our conversation with Mayla Yang, Community Outreach Specialist with Trellis. And we're talking about Senior Linkage Line and the open enrollment period and all the valuable resources available to all Minnesotans. And I want to make sure you know that this is the place to get your questions answered. All right, you are listening to Living Healthy and Aging Well. I'm Ken Hageland. Please stay with us.
SeniorCommunities.guide is your free online website to find housing, care, and resources for seniors in Minnesota. Use the powerful, award-winning search tool to quickly improve your search. You will have all the information you need to contact providers directly without any hassle. Start your search now at SeniorCommunities.guide and follow us on Facebook for interesting articles, helpful advice, and how older adults are changing the world.
SeniorCommunities.guide. Overwhelmed trying to make sense of Medicare? As a licensed advisor, I can help you determine your healthcare needs and evaluate your options. I'm Harvey Pearl of Pearl & Company, and I want you to have the peace of mind knowing you have the best coverage available. You deserve an advocate you can trust and coverage you can rely on. And there's no fee, ever. Annual enrollment is October 15th through December 7th. Call me now at 651-303-8889 so we can strategize together.
Connections Radio Show is all about tapping into our hardwired hunger to connect. We examine meaningful connections to ourselves, our community, and the world around us. By opening the door to innovative insights by a wide variety of interesting guests, we'll make the connections to something bigger than ourselves. Join me, Lori Fitz, your host of Connections Radio Show, and together we'll make the connections. Saturday mornings at 9 a.m. on AM 950, the progressive voice of Minnesota.
The Senior Linkage Line is a free, statewide service of the Minnesota Board on Aging, helping older Minnesotans and caregivers find answers and connect to services and supports. Questions about Medicare, transportation, looking to move to senior housing, overwhelmed with prescription drug plans? Call the Senior Linkage Line at 800-333-2433 or visit trellisconnects.org, where we help people optimize well-being as they age. That's trellisconnects.org.
Experience the difference of intergenerational childcare. Kinder Village brings together the wisdom and warmth shared freely by the older adults of Episcopal homes with infant to preschool-aged children. The goal? To provide each child with a safe, loving, and secure place that promotes learning and fun. Now is the time to enroll your preschooler in a place of endless learning and love. Kinder Village has earned the top 4-star rating from Parent Aware. The children enjoy arts and crafts, reading, story time, and playing games with their many grand friends. Teachers provide lessons in science, math, music, instrumental movement, language, and literacy. The campus kitchen prepares nutritional snacks as unique as the children it serves. Kinder Village Days mix free play and structured activities, allowing children to learn and grow in a flexible and diverse setting. Children who are part of intergenerational activities have better social skills, have less aggressive behavior, have improved learning, and find understanding of those with disabilities. For more information or to enroll, check out kindervillage.org.
All right, welcome back, folks. You are listening to Living Healthy and Aging Well, where we talk about ways to improve your health and quality of life. My name is Ken Hageland, and joining me today is Mayla Yang, a community outreach specialist with Trellis. And we are talking about Medicare's open enrollment, and we're also talking about the Senior Linkage Line, which is a great resource for all Minnesotans, regardless of your age. You don't have to be a senior to call the Senior Linkage Line. And so we're going to finish up this last segment talking more about the services that Trellis has to offer to all of us here. And Mayla, let's make sure we get information out to people. If they want to get more information on the website or the phone number, why don't you give those out for us?
Yeah, so our website is trellisconnects.org, and then the helpline number is 800-333-2433. We are available Monday through Friday, 8 to 4:30 p.m.
every time I talk to you guys, I always learn something more about the services you guys
happy to hear
provide.
that.
No, it's great. And I want to make sure we just reinforce that with people. What do you wish people knew more about regarding your services?
Right, yeah. And so we always like to say, when in doubt, give us a call. If we do not know the answer or do not have the correct answer, we can connect you to someone who does. And so we are happy to provide clarity for our consumers. And many people do not know all of the areas that we can help with. And so, if you're hesitant or you're unsure, give us a call and we may be able to help you. For example, we can screen people for programs such as the Federal Extra Help Program that can result in significant prescription drug savings. Tens of thousands of Minnesotans on Medicare may qualify for this program, but they do not apply because they are unaware of this program that is available. And so the Senior Linkage Line staff can mail out an application to the consumer, and then the consumer can complete that application and mail it to Social Security office. And then from there, within about 2 weeks or so, they will get a letter in the mail kind of stating, yes, you qualify for this program, or no, you do not qualify. And if you do qualify, you'll be saving tens of thousands of dollars on your prescription drugs. And so that's a great service that we like to help with because we want to be able to help consumers save money. And if it's with those who are low income, that's even a greater joy for us at the Senior Linkage Line. One story that I wanted to highlight from this is one of our amazing volunteer, Chris. She's been with Trellis volunteering for 6 years on the phone bank. And so Chris took a routine call from a couple asking about their Medicare plans. And they were 2 retirees, married, and share the same Medicare network. The couple, they were wondering if it was possible to select different pharmacy plans within the same network because the 2 spouses had widely different medical conditions. And so Chris started asking questions, listening to their concerns, and understanding their situation and what they really wanted. And so her expertise and persistence led her to suggest several different options for the couple. And so ultimately the couple chose the same plan, but different preferred pharmacy options. And the amazing thing about this, Ken, is that they were able to save about $1,400 a year. And so the couple had, were just so thankful and shared that with that money that they saved, they were able to possibly go see their grandkids. And so these are, stories that bring us joy and why we are so, appreciative of the work that we do at the Senior Linkage Line.
So let's just remind people as we are getting near the end of the show here, how they can get more information.
Yes, so if you want more information, you could call us at 800-333-2433 or check out our website at trellisconnects.org. Everything that we talked about today, the resources, the services, the presentations, or how to schedule for a Medicare one-on-one appointment is on our website. Under that Get Help tab is where you can find the Medicare one-on-one appointments to be scheduled on, based on what works best for you, or presentations that are available in the community setting or virtually on Zoom.
Mm-hmm. And that's the nice thing that people need to realize is that you can go to community centers and get great information. Right. And we also schedule one-on-one time. And I think sometimes our seniors feel a little rushed when they're trying to call in for things. And sometimes they don't even know what they're even trying to articulate because it's complicated. And it's nice to be able to say, I know I've got an hour, so I can relax and I can share what my concerns are. And it's what's great about that is that this is an opportunity to save money. As you talked about, there's many programs. There's a lot of options out there that people have available to them. They just don't know about it.
Right. That is very true, Ken. And so that's why we at the Senior Linkage Line are here. And so, like I said, if you are unsure, if you want clarity, give us a call. Don't be afraid to call. Don't be shy to call us. We are here to help. Our services are free and available to all Minnesotans. And if they are the Medicare one-on-one appointments, like you said, those are great for those who have questions but are unsure. And so we want to help the consumer to make the best and most informed decision for them.
Yeah, and what I want to make sure people realize too is that you can call more than once.
Right.
They don't keep track and say you only have one call per month.
Right.
Especially this time of year.
Yes.
Don't be shy.
That is correct, Ken. And this time of the year, the season, the open enrollment, October 15th to December 7th is one of our busiest season at the Senior Linkage Line. But please do not hesitate to call. You can call every day if you want to ask about your plans, or you can set up an appointment and have someone, a specialist, listen to your concerns and then help you to make the plans, whether you want to change your Medicare plan or stick to the same one. The specialist will be able to listen to the concerns of the consumer.
Right. And remind me again, does this cost any money?
It does not cost any money at all. It is free, and we're neutral, and we provide, we give the options that are available to the consumer. So we are free.
And you're unbiased. You're
Right.
just trying to present information so people can make up their own mind. Now, are you able to have like an adult child and the senior on the line at the same time? So if they're trying to make sure they get all the information, because sometimes the information's a lot to absorb at one time.
Yes.
So you guys can do that as well.
So that could be a possibility. And so, if the older adult is not able to join the call, the caregiver can set up the time that works best for them. And so they both can call, or
Perfect.
either one can call.
Perfect. All right. Well, we are nearing the end of the show here. I want to thank Mayla Yang, an amazing person.
Thank you.
No, really. You're just a great representative for Trellis here. And she's the community outreach specialist with Trellis that's been on the show here. And we've been talking about Medicare's open enrollment period. Now, this is an annual open enrollment, folks. So it's important you get your questions answered and give Senior Linkage Line a call. Let's remind them what that phone number is again one more time.
Yes, 800-333-2433.
All right. Well, I want to thank you. I also want to thank Jetta Wiedemeyer-Bauer, the Volunteer and Outreach Manager, for helping set this up. We're so grateful for her. And we hope you enjoyed today's show, folks. Please contact us with any questions or comments you have regarding today's conversation. You can always reach us by voice or text at 612-999-3426. Please join us again next week for another live broadcast. And thank you for listening to Living Healthy and Aging Well, where we talk about your health and your life. Until next time, live well.